Sam Seder on the Majority Report. Emma Vigeland out today. Want to welcome back to the program Dr. MarkAlain Dery, infectious disease specialist, founder of community radio station 102.3 WHIV-FM in Nolens, and creator of the NoiseFilter podcast. Doctor, we spoke to you a lot during COVID. I have mixed feelings about talking to you again because of that. But going forward, we may have occasion to talk about these things, particularly based upon my one of my former coworkers in radio, Robert Kennedy, who is now in charge of our public health apparatus in this country. Broadly speaking, give us an overview of your concerns regarding Kennedy in that position.
Oof, that may take the rest of the show, really, quite frankly. I mean, let's just say the first meeting in which he appeared at that cabinet meeting, the one where they were all around and Musk was there. And when the reporters asked the president about the measles outbreak, the president kind of deferred to Secretary Kennedy. And right off the bat, the first thing that he said is that there were 2 deaths. And let's just be clear, there's been 1 death from measles. How do you get that wrong? Do you know what I'm saying? Like, how do you
it's off by one person. It's off by one person.
Or 50%, whichever way you want to look at it. Yeah. So, so that was right off the bat. There was a lot of us in the medical world. There was just a big, long eye roll and a sigh. The second thing that I think that he did that's also very concerning as well, amongst the many things, but the things that if I pull it all together, was that he canceled the annual meetings of the ACIP, this is the American Committee, I think, for Immunization Practices. These are the folks that meet in March every year. These are very transparent. These are public scientists, not government scientists. And even if it was, we love our government scientists, but these are public scientists that meet every year to advise the government and pharmaceuticals as to what is going to go into the annual influenza vaccine that would happen in October. That meeting was canceled, and a second meeting was also canceled. Now, that doesn't mean that we're not going to get an influenza vaccine. We're probably going to lean on the WHO's recommendations to get that. But it's funny that we would leave the WHO, and then now we're still using WHO information. So it's things like that that are very concerning. Of course, muting the NIH and canceling a number of contracts and their ability to speak to the public, and the same thing for the CDC, and then pulling out of the WHO. Those are like the big things that I see being very problematic. And then I guess the last thing I would say is his, recently he penned an op-ed. I think it was maybe for Fox News. I can't remember who he did an op-ed for, in which, finally he said, yes, vaccines are good for the measles, what have you. This is the number 1 prevention. Of course it is. But then he goes off on these tangents of cod liver oil or vitamin A and these things that kind of take us back to the RFK that we knew he would possibly be. Now, vitamin A in countries that have chronic vitamin A deficiency in the setting of measles, yes, that's good. We don't have vitamin A deficiency in this country. So when you're talking about vitamin A, people may, kind of the same thing they did with hydroxychloroquine. They may use that as a substitute for what the best thing to do to prevent measles is actually the vaccine. And even in the setting of a epidemic like we're seeing right now, people who are unvaccinated can still go and get a measles vaccine and still be protected within a couple of days. So it's just a lot of confusing information. And I think we're going to see, I think I'm going to be on the show more often. I think I'm going to be making these visits more often, because we are going to, one of the things, like you said in the intro, was the NoiseFilter podcast, which we did during COVID, during the pandemic. We're having to resume that podcast, that radio program, because the CDC and the NIH have been muted, and there needs to be voices that are out there that can kind of help explain what's going on, at least from the infectious diseases perspective.
So you're a practicing doctor, but you also are involved in public health in the context of is it Access Health Louisiana?
Access Health Louisiana,
which is, if I remember, the biggest Medicaid provider in Louisiana.
Louisiana, yeah. Go ahead.
Will you just, so the people understand this, will you describe the difference between practicing medicine, not the actual application of it, but the sort of the conceptual difference between being a medical practitioner and public health? Like these are not the same things per se, right? And will you explain that conceptual difference? Because that's important, I think, when we talk about Kennedy saying, at Fox News, writing down, and who reads anymore, get a measles vaccine, and then sort of going out and giving interviews saying, well, cod liver oil, which has a lot of vitamin A and, whatever it is, that in addition to the fact that one is preventative care and one is sort of trying to mitigate the impact of getting a disease. But will you talk about just sort of like broad strokes, that difference between practicing medicine and public health as a concept?
Yeah, I mean, I could say it in one sentence. When you're practicing medicine, like I'm at work today, I'm at the hospital. This is where, the last couple of years, this is where my practice has kind of evolved into. I am seeing one patient, one person at a time. When I'm practicing public health, I am reaching tens, 20s, hundreds, thousands of people. And when I was doing radio, literally tens of thousands of people all at the same time. So as public health practitioners, we are quite literally impacting the public's health. Versus as a physician, as soon as I'm done here and I continue with my rounds, I'm seeing one patient at a time. And the work that I'm doing is impacting that one person at a time. But conceptually speaking, when you're talking about public health, you're weighing risks in a slightly different way, right? Are 100%. You not? Okay, would you just walk us through that? Because there is no medication that is 100% safe. I mean, there's nothing you can say that about. And as a individual practitioner, you make an assessment on an individual basis that may deviate from broad strokes what is good for public health policy. But public health policy the health is not of the individuals in society, but rather society as a whole. Yeah, I mean, 100%. I mean, let me give you an example of what's happening here in the state. In fact, I had an op-ed that just that ran yesterday in our local paper here, The Advocate, and the op-ed was in response to the health commissioner, the state health commissioner, and the state health commissioner. And in fact, it was timed right after RFK was confirmed. Like minutes after they were confirmed, a planned letter was sent to the Louisiana Department of Public Health, in which the state commissioner was telling the Louisiana Department of Public Health to stop all mass vaccination programs and to stop promotion of all seasonal vaccines. So the idea, again, is to stop, to stop the communication. And in my letter to the editor that was published yesterday, I talked about the example, and I think I came on here and I talked about it a bit a couple of years ago when we were seeing Mpox. And we had a we had an Mpox outbreak here in New Orleans that happened in the summer of 2022. It was in August of 2022. That's important because at the end of August, early September, we have what's referred to here locally, colloquially as Gay Mardi Gras, which is called Decadence Weekend. And Decadence, this is where you were going to see lots of LGBT community coming together. And at the time, Mpox, and it still mostly is mostly transmitted, mostly not exclusively, but mostly transmitted amongst men who have sex with men in a sexual contact. And so we were incredibly concerned that we would see a large outbreak of Mpox as a result of Decadence Weekend happening here in New Orleans. And so what happened was that the state health department, the New Orleans health department, and the CDC came together and did mass vaccination programs in which they vaccinated a large portion of the LGBT community here in New Orleans. I was actually exposed. I actually was part of that vaccination. I got vaccinated myself because of an exposure as a result of a patient, of seeing a patient, and I was not in PPE. I was not expecting to see the Mpox. But the point that I'm making, a larger point that I'm making goes back to what you're asking, Sam, which is without that ability to have done that, we would have definitively seen a larger outbreak of Mpox that would have happened here in New Orleans in that summer of 2022 because of that getting together of people's, like I said, in decadence. So what we do in public health, like you said, there's no one fixes all. It has to be slightly tailored depending on the communities that you're working with or what have you. And what we saw with these mass vaccination programs that we're not doing in New Orleans or in Louisiana anymore. So I don't know what would happen if there was a measles. We're on the other side of Texas. So what happens? And my big concern was that we just got through Mardi Gras. In fact, this time last week, we were just recovering from Mardi Gras because it was last Tuesday. And I was advising people who were not vaccinated for measles to not come to Mardi Gras and to not be at parades for fear that we would see outbreaks of measles. And we're still kind of waiting. Right now, we're at the end of the window. So, hopefully we got out of it unscathed. But the larger point is that public health is incredibly important. We're seeing it being muted all over the country, including here in the state of Louisiana. And without the public health practitioners being able to do what they do, I really, really foresee that we're going to see problems moving down the line. And one more thing real quickly. In Houston, there's going to be a very large rodeo in the next couple days, and it lasts for, I think it's a week, and it brings in lots of people from Texas. And the concern is what happens now when you have people from the western part of Texas that are going to come to this rodeo who may have asymptomatic measles, or they may have an early, and they don't realize that they are, they're still asymptomatic, that could potentially also cause an outbreak to happen. And as public health practitioners, these are the things that we're constantly looking for, kind of trying to see where these things are so that we can get in there and mitigate it, prevent these things from happening.
All right, let's talk about what the things that keep you awake are. I remember one of our early conversations about COVID-19, and I said, what is your biggest concern? And I think you said COVID-22, 2022. Which ended up being, I think we called it Omicron at the time, or a different variation, which was highly problematic because we had developed a vaccination and a vaccine for the wild type of COVID-19, and then it mutated several times, and it was very hard to get in front of that. I want to ask you about long COVID, but let's first, what are the things that are on your radar right now as somebody who works in public health?
So I think the two things,
obviously measles,
measles, yes, but just far, far, far and away is bird flu. Far, far, far and away is bird flu. And then the second thing is this hantavirus that surfaced in New Mexico. And let's start with that because that'll be quick to get through. The reason why that worries me is, let me take a step back.
Hantavirus is the one where you are in a fairly enclosed space that may have a lot of rodent feces. Yeah, is that right?
I'll explain Hanta, because I actually diagnosed 2 cases of hantavirus when I was on the Navajo reservation when I was doing my public health payback for medical school. So let me just quickly remind everybody that in 2014, 2015, I went to West Africa. I responded to the Ebola outbreak with the WHO, World Health Organization, hired me to go and work as as basically a clinical epidemiologist on the ground in Freetown, Sierra Leone. The reason why I mention that is that prior to that outbreak, it was not known that Ebola was in West Africa. We thought it was confined to East Africa and Central Africa. But when you look at the reservoirs, the fruit bats that carry Ebola, their entire flight path starts kind of in southern Africa. It goes up around East and Central Africa, and it ends in West Africa. So there's no reason to believe that it was never in West Africa until we started seeing deaths. Now, the reason why we never knew it was in West Africa is because when people die in West Africa, a large number of those countries, especially in Sierra Leone, Guinea, and Liberia, don't have electricity. So people are buried. The traditions are people are buried very, very rapidly. And they didn't have the PCR technology to diagnose Ebola. But we now know that, yes, a major outbreak had happened. We just had never really seen it or thought about it. So now let's take that and think about it from a Hunta perspective now in New Mexico. So what is hantavirus? It's another one of these so-called viral hemorrhagic fevers. This virus affects the heart and the lungs. We first were aware of it on the Navajo reservation in 1992. That was the first time we really had seen hantavirus. I don't know if you remember, I remember I was in public health school. So for me, it was very exciting to kind of see this whole thing unfold and how it was diagnosed. The first two cases were a couple who were together. They were very athletic. They were marathon runners, and they died very, very quickly. And that brought the CDC out. And that virus ended up being called sin nombre, which means without a name, because they initially wanted to call it the Four Corners virus, because that's on the Navajo. The Navajo people were like, there's no way you're doing that. They called it sin nombre. So what is the concern here? So when I was on the reservation in 2005, in January of 2005, in fact, this has a climate change element to it, because usually you see it in spring or the summer. And what we saw in January, early January, I diagnosed a case in a 15-year-old young lady. It still gives me and my colleague, and we talk about her regularly, chills to even think about it. She was very, very healthy. She came to us in distress, and unfortunately, she passed away. And that was on the way to the pediatric hospital in Phoenix. We were in Page, Arizona at the time, the Navajo Nation. And so there was an outbreak that happened. There was 6 cases. So I diagnosed the first case, and I diagnosed the last case. And this is a very rapidly progressing virus. So what happened? So Gene Hackman's wife died, right? And of course, Gene Hackman died, right? So as a result of their kind of unusual deaths, they did very intensive autopsies to determine what it was that they died from. And they likely found the virus in her lungs. And so what is of concern for me is that it could be that we're seeing more hantavirus. I don't know, but just using that same Ebola, kind of what we learned from the Ebola perspective, that what we're possibly seeing with hantavirus is that maybe there are more cases of hantavirus that never have been diagnosed. It could be that an elderly person goes to the ER, they may have a bilateral pneumonia on both sides, and then it just consumes them rapidly because we don't really do autopsies anymore. And then nobody thinks about hantavirus because usually you see it in the setting of a pandemic. And interestingly enough, like you said, the reason why we see it on the Navajo Nation is that the traditional Navajo still live in things that are called hogans. And hogans are kind of the traditional Navajo living dwellings, if you will. No electricity, no really running water. Oftentimes the ground is the dirt ground of the desert. And these deer rodents that carry this virus, when you and I have a flight or fight response, like our pupils dilate, our GI tract shuts down, and we run, right? But these rodents, their flight or flight response is immediately to evacuate their bowels and to empty their bladder. And the virus is carried through the stool and the urine. So later when it dries and when people are going through and sweeping or what have you, this is aerosolizes the virus. And this is how
can it be person to
no person-to-person transmission.
No person-to-person transmission.
No person-to-person.
Okay.
So that keeps me up. That really scared me. But the real big one is bird flu. And I'll tell you another story that's happened fairly recently here in Louisiana. So there's only been 3 hospitalizations of bird. Let's take a huge step back. So we've seen bird flu go through, and I think one of the last shows I may have started talking to you about bird flu because, again, we're doing this and I'm like, bird flu may be a thing that's coming. What we saw was a lot of the chickens were culled during COVID. And in fact, I think I remember talking about it here. And that was why in 2022, we saw a rapid increase in the price of eggs, was because there were a lot of chickens that were culled. As a result of the culling, chicken prices or egg prices went up like we're seeing right now. So those chickens were killed. But then of course it's still circulating in the wild. So then the birds were able to transmit to large mammals. So we started seeing in large mammals, ultimately to bovine. And I just checked this morning, I think there's almost 800 different herds of dairy farms around the country that are now are infected with this bird flu. And so right now it's mostly limited to bird flu. And I read a really interesting study in which there was a bunch of, the CDC went to a veterinarian conference and people just voluntarily gave blood. And they found that 3 out of the, I think 15 or 20 people that that gave blood had antibodies for bird flu. So we are seeing some asymptomatic transmission to humans. So these veterinarians didn't know that they had bird flu, but they had been interacting with these cows.
So if I understand, the danger here is that either through, let's say, non-pasteurized milk, where the bird flu is not been killed, or through people working with poultry in some fashion, or conceivably in the wild, but less likely because you're not in direct, you rarely are in direct contact with wild birds as, just an average person, but that the bird flu transmits to someone who has an existing human flu, and that this creates a mutation, and that's like sort of the real concern. Like bird flu in and of itself is not human to human transferable and is not hugely lethal. I guess both in terms of like an R value, which is how it transmits, but also in terms of the severity of it. But that if it mutates with an existing flu, then it could be off to the races.
Right. So let me kind of let's kind of unpack that. So yes, we're not interacting with birds that have bird flu unless they're dead. So that's the concern. So it's people who are interacting with dead birds. So who are that? They're hunters. So if you're hunting and you find, put on PPE before you, and so, but the case that I'm driving to is the case that happened in Louisiana. So we don't know the details. The CDC has not released it. The state of Louisiana has not released any details about the person who got it. All we know is in southwestern Louisiana. So this was a person who interacted with a dead bird in his or her backyard, in their backyard, and got the flu, bird flu, was very, very, very sick, was in the intensive care unit, and then ultimately died. Now, interestingly enough, the CDC was at the bedside, and they were drawing samples, and while this person was still alive, and what they were doing is they were culturing the virus. They were able to culture the virus, and they were able to understand its genetics. And what they saw was that the virus was mutating while it was in the host, and it was mutating. The genes were lining up. They were arranging themselves in a way that it was making it more likely for human-to-human transfer. Now, it didn't happen, but what they documented was that the genes were lining up and positioning themselves in a way that there could be human-to-human transfer. But the scenario you're talking about is truly the thing that keeps me up at night. And that is these workers that work with the cows. They can't wear PPE because they have these, first of all, they have these huge fans that are going on. There's feathers, there's all of this.
This is before pasteurization, Right.
Yes, before pasteurization while they're working with the cow. So if one of these folks are subject to the bird flu and they happen to be co-infected with a human flu, the idea is if you have two of these different flus in one cell inside your nares, your nostrils, inside there, if two influenza viruses are next to one another, they're going to mate. They're going to have viral sex. And the thing that we're concerned about is what happens if the bird flu part gets the human-to-human transferred genetic portion. That's called recombination. That sex that they have is called recombination. So those genes recombine so that you end up with one flu that's bird flu in nature, but has the element of human-to-human transfer. That's the concern, and that's the thing that keeps me up at night. Some good news on that end is one, well, first let me also say that the bird flu as it stands now, there's been about 800 cases around the world. We've been following this for several decades now. It has a 50% mortality rate, okay? And it's mostly healthcare workers who are dying because they're the ones that are interacting directly with the patients. But if that, and we've talked about this a number of times here on the show, if the bird flu does end up popping off, if it ends up evolving into an epidemic, there's no way it's going to have a 50% mortality rate, because you can't be a virus that's highly transmittable and also highly have a high mortality rate. That's just in nature. It just doesn't exist.
Right. You burn out your kindling too quickly, essentially.
Right. So you're going to be one or you're going to be the other, right? So you either have high mortality rate like Ebola or hantavirus, but you have low transmission rates. Or the flip side, you have high infectious, right, like measles, but you don't kill your host, right? You want to be able to transfer. I think bird flu is going to be a little bit, I think it'll still have some mortality rate. It's definitely not going to be COVID or flu, but I'm completely speculating at this point. But the good news is right now, we could vaccinate 20% of the country, like right now. We could vaccinate 20% of the country, and prior to the current administration, I could say that they were preparing for mRNA vaccines. And this is another thing that keeps me up at night, is I don't know what happened. With the adversity to vaccines that the current administration has, I don't know. And then also, what happens if we want to leave the country and we are not, it could be that other countries now are going to start looking at us, frankly,
potential carriers.
Yeah, exactly. Yep. So, then the last thing I'll say about this too, Sam, is that the rest of the world is looking at us, and they're writing articles about, hey, America, chop chop. Like, we see what's happening. The nice thing about public health, it's not hard. You can predict these things. Mpox is here a month ahead of decadence. We know if we vaccinate now, we're not going to see an outbreak come decadence. These are not difficult things. And what we are seeing right now, and our lack of action, is very problematic, because we are inching closer and closer to a potential bird flu pandemic. I am concerned about that.
Well, I hope we don't have to talk about that again, but I fear that we might. Dr. MarkAlain Dery, we'll put a link to your relaunch of NoiseFilter as a way. People, we don't have the same public health apparatus that we did, frankly, 3 months ago. And so projects like yours, hugely important. Thank you again. Really appreciate it.
Thank you.
Hey, folks, don't forget to hit the subscribe button and check out our daily show. We do it every day at 12 p.m. Eastern for about 2.5 hours. We even take phone calls. You should check that out.